here today as the inaugural, I guess, presenter for the KT event between NBIRDT and Department of Health, as Tracy mentioned. And so today I'm going to be presenting to you some results of a survey on mental health impacts of COVID here in New Brunswick. And so our team at NBIRDT engaged in this work. You will probably mostly be familiar with IRDT, thinking about administrative data, but we have definite research capacity research functions, which include analysis of survey data, but also development of survey materials. And so some of the work that I'm going to present to you today is part of those additional activities. So this does not include administrative data at all. And what it does include is survey results from an online survey that was a national survey conducted across Canada. It was conducted by Polaris Strategic Insights and Mental Health Research of Canada. And this was a partnership that they formed at the beginning of COVID in order to roll out 13 surveys that touch on similar questions across the different rollouts, but have additional questions to add key things that are pertinent at the time. So for example, the more recent surveys have included questions about vaccination because that has become more evident and necessary to look at. So the data that we'll present to you today is the second of the 13th survey that they conducted, and that was conducted in August 2020. So this is a snapshot of the impacts of COVID prior to this past fall winter that we just experienced. And so the survey results that we received from Polara and Mental Health Research Canada include 503 respondents. So this is an oversampling of the New Brunswick population. The previous samplings and all the other surveys do include New Brunswickers, but only about 100 individuals. So it limits our ability to look at the data in different ways just because of the sample size. This was an online survey that was just included for individuals who are over the age of 18 who provided consent to complete it. So the responses that we provide in this report, as well as in this presentation, are summarized for all 503 individuals, as well as for 8 population subgroups that we defined according to age. So we've got 3 different categories, as you can see there. Household composition, so these are people who live alone, people who are couples only, and people who live in families. And when we say families, this is really defined as having children in the home. And when we also looked at specific vulnerable populations, mainly those individuals who identified as having a previous mental health diagnosis, as well as frontline workers. And so the way we defined frontline workers was really focused on what GNB defines as frontline workers. So we identified a list of essential frontline workers from GNB directly, and used that to categorize the responses in the survey into to be able to identify those individuals. And so those are 2 particularly vulnerable populations that we've identified for this report. So our analyses focus mainly on 3 sets of survey questions. There are a lot of questions in the survey, but just to orient ourselves at first, we thought, why don't we take a first look at what are the impacts of mental health on social factors, economic factors, and recreational activities, as well as what are the impacts on changes in frequency of specific negative behaviors. And so these include increases or decreases in cannabis use, in alcohol use, as well as household conflict. And then just to look at questions that relate to New Brunswickers' confidence and ability to recover from the challenges and barriers that COVID has imparted on their lives. And so these are the set of questions that we will talk about today and that are outlined in the report. Because we have a lot of data and we were taking a first look at it, all the group comparisons that I've described today and that are described in the report are strictly qualitative. So what that means is we did not do statistical analyses in the sense of, is this group greater than that group, just because there's way too many comparisons, and the approach to statistics is not valid because it wouldn't be hypothesis driven. But some of the work that we've already done in presenting this have identified key hypothesis-driven questions that will allow us to look at that. So this is a first look at these data. So we also welcome your comments on some interesting ways we might be looking at these. So the selected subgroups are these, and I identified them here just to give you a sense of how many people fit in each of these categories. They're not mutually exclusive between the different categories. Clearly age is mutually exclusive, and so our household compositions, but you know, the age groups would include people who are in the household composition. So these are not independent people across the groups, but depending on how they answered or responded to these particular characteristics. All right, so just moving into the results. So the first part I had mentioned, we looked at social factors on mental health. So in the graphs that I'll show you, they present the different factors as well as the proportion of people who responded using the different response options. So as you can see at the top, we have don't know, not applicable, but then it goes from very positive, which is light gray, to very negative, which is the red. And so we first present the results for all of New Brunswick, and then I'll look at the specific subgroups with you guys. So I've just highlighted to bring the attention to specific groups that are particularly important. So these were the factors we looked at: catching COVID, a family member catching COVID, getting necessities, social isolation, interacting with household members, and interacting outside of the household. So as you can see, those factors that I've highlighted in red really do seem to stand out as having more of a negative impact on individuals in New Brunswick. But we can definitely see that when comparing family members versus oneself catching COVID, that there is much more of a negative impact, not much more. So there is more of a negative impact among those factors, as well as for social isolation. So when we break this up by the specific population subgroups, we see some interesting findings as well. We do definitely see the predominance of individuals reporting more of a negative mental health impact as a result of their family members catching COVID as opposed to themselves. But we do see that there's particular groups that may be at higher vulnerability. And here we can see that people with previous mental health conditions, as well as frontline workers, have about a 25% chance of reporting that they had a very negative impact, as well as quite a substantial overall negative impact when we add the two red bars together. When we look down at the possibility of oneself catching COVID, it's always lower, predominantly than the previous graph, but this is really interesting to be able to compare across. So social isolation was the other one that I pulled out, and two particular groups that we noticed had a particularly negative impact, again, on their mental health, were seniors, or those individuals who are over the age of 60, as well as individuals with previous mental health conditions. But as you can see, there are other groups that had reported somewhat negative and very negative as well. So these also have important implications for different population subgroups. So impacts of economic factors was the next set of results or survey questions we looked at. And so here are the economic factors. Economic downturn was among the highest reported factor to impact mental health negatively. So as you can see, about 27% and 15% have reported a negative mental health impact. And when we look at that by individual subgroup, we see that some groups are reporting higher negative mental health impacts than others. Here I've highlighted in particular our two vulnerable groups, so those frontline workers, as well as those with previous mental health conditions. In addition, families appear to also have a higher proportion of individuals who are reporting a negative impact as a result of the economic downturn. So these were another economic questions that we looked at, and these were just demonstrating that the differences between the possibility of oneself losing a job or losing hours, as well as the possibility of family members losing hours. So it does seem that the possibility of oneself losing hours or losing their job is having more of a negative impact on some of the populations than the possibility of a family member losing a job. And as you can see here, some of the higher reported groups are the younger age groups, so those 18 to 39. Those couple-only families had a 23% chance of reporting a very negative impact on their mental health, as well as those with previous mental health conditions. Similarly, for the possibility of a family member losing a job, we also see the highest proportion among those who are 18 to 39 and those with a previous mental health condition. I just wanted to pull this one out. So it wasn't necessarily overall on all 503 respondents rated extreme highly, but it did show quite a bit difference across the different subgroups. And so most of the factors that we did look at, while there are slight differences between groups, overall the messaging was kind of similar. They were having a similarly negative impact. Some had slightly higher or lower, but here you can kind of see a bit of a difference in that the possibility of not being able to pay bills is much more predominant in particular subgroups. So those 18 to 25-year-olds, 18 to 39-year-olds, families, and those with previous mental health conditions, as well as frontline workers, whereas the other groups, the impacts on the negative impacts on mental health were quite a bit lower. So this was our look at recreational activities. So things that they examined in the survey include the daily news, that was things related to COVID specifically, social media, physical activity, entertainment, and recreational reading. So I've highlighted daily news as being the factor of recreational activity that had the most negative impact on New Brunswickers' mental health, whereas we can see that recreational reading means non-COVID related reading, and that had the lowest negative mental health impact and actually quite a substantial positive mental health impact. And so thinking about activities that we can encourage our population to engage in to improve mental health might be warranted based on these results as well. So those with previous mental health conditions to negative, somewhat negative impact as a result of the daily news of COVID. And so this is particularly problematic as well, given the particularly vulnerable population that these represents. So in addition to how different factors that I just described impact individuals' mental health, we know that negative behaviors are clearly going to impact people's mental health. And COVID did make quite a change in everyone's life. And so engaging in negative behaviors that increase is particularly problematic and is important to keep track of course. And so as we can see here, the lightest gray bar means that didn't happen before, they didn't do this, so they aren't able to comment on whether it increased, decreased, or stayed the same. And so what we do see here is that cannabis use is substantially lower overall in New Brunswickers who responded to the survey, but increases in alcohol and household conflict are quite a bit higher. And so we'll look a little bit more at those. So the top graph here just shows you the results for alcohol use. And so we can see that there's certain groups that are higher than others. And in particular for alcohol use, the youngest age groups, so those who are 18 to 39, and frontline workers. So overall, the changes in frequency for alcohol use overall for New Brunswickers was quite similar to the national average. But among these two subgroups, so that younger group, as well as frontline workers, were quite a bit higher. So the younger group was substantially higher. The frontline workers was slightly higher. But this is particularly problematic as well, as of course, because we understand the implications of increasing alcohol use. Of course, this didn't capture how much increase, so it could be a little bit of increase. So the quantity of increase is not reflected in these questions. Household conflict also was something that came out as having a increased effect, but we do see, based on the dark red, right to the right, that there are particular groups that have more increases than others, and in particularly household conflict between families, individuals with previous mental health conditions, as well as those younger individuals who might also quite substantially overlap with the families, given that's an age range of common to parents. So now just to end off with a bit of here, the graph is a bit of different, so I've put a little note here to indicate that darker is better, because when I presented this once before, someone said, "Oh no," but this is actually a relatively good news story. So red and dark red represent confidence, inability to recover, and so we can see that overall New Brunswickers are reporting that they are confident or somewhat confident in their ability to recover or bounce back from the challenges that have been imposed by COVID. As we can see, individuals with in the oldest age group have the most confidence in their ability to recover, which is really interesting. I didn't expect that finding, but that is promising, as well as the group who had the least amount of confidence in ability to recover was those with previous mental health conditions, and had the highest proportion of individuals who reported somewhat poor or very poor in their confidence in their ability to recover. Overall, just to summarize all what I've presented, so the possibility of oneself or a family member catching COVID, social isolation, and the economic downturn had the most negative impact on mental health. Among the subgroups that we selected, we really did observe that there was quite a similar level of the various factors examined. So as I mentioned, we didn't do statistical comparisons of these tests. We summarize the results and present them for discussion. But overall, they're quite similar. And overall, the results for New Brunswickers in these 503 individuals were similar to the national averages, except for the few that I've noted already today. However, young adults, so those 18 to 39, those with previous mental health conditions, frontline workers, as well as families, may report more negative impacts on some factors, as well as greater increases in these negative behaviors and less confidence in the ability to recover. And so these results represent, of course, a time when COVID was, more benign at the time at the end of the summer. And so what we're planning with Mental Health Research Canada and Polaris Strategic Insights is a second oversampling here in New Brunswick. And so that's being planned for April. So that'll come out in the next few weeks, and will be able to give us a sense of how these mental health impacts have changed since the summer and over this more predominant COVID outbreak fall and winter that we've all experienced. So we'll be able to examine this and see how things have potentially changed. Of course, they're different individuals, but it'll give us an overall sense of some of this information. So that's what I had to present today. I hope I'm still okay on time. And I guess I'll just turn it over to those organizing to lead on to the next piece.